Welcome back to Coursera. This is Lecture 2 about the upper limb. Before we go much further, we need to have some additional conversation about the nomenclature, or how structures are named with regard to the upper limb and other body parts, as they are related to something called the anatomic position. So if we look at the next slide, what you're seeing here are two adults standing upright with their feet together and the palms of their hands facing forward. In both of these individuals, what you're seeing is what we describe as being the anatomic position. And utilizing a series of planes, or positions where we actually look like we're cutting through the human body in three mutually perpendicular planes, we arrive at a whole additional set of terminology to describe where anatomic structures are relative to one another and relative to the plane that we are discussing. For example, we can start this discussion by making an incision or developing a plane that starts, for example, at the nose and passes directly through the back of the body wall, in this case the skull, or the neck, or the trunk, or any other body part. And when we create a plane that goes, in essence, from the front of the body out the back wall of the body, that's considered to be the sagittal plane. And based on the sagittal plane, we arrive at a series of terms, two of them, that describe the relationships of anatomic structures relative to that plane. For example, if a structure is closer to this so-called mid-sagittal plane that's going right through the middle of the body from front to back, that structure is considered to be medial. And if a structure lies further away from that mid-sagittal or sagittal plane, we describe that structure as being lateral. For example, in the anatomic position, there's the thumb and there's the pinky, obviously two of our topics of discussion in the upper limb. But we would say correctly in the anatomic position, the thumb is lateral to the pinky because it is further away from this mid-sagittal plane. We would also say in the same conversation that the eye is medial to the ear because it is situated closer to that mid-sagittal plane. Then, oriented exactly perpendicular to that is another plane that basically goes, for example, beginning at the level of one ear and it goes out through the other ear. So this second plane is called a frontal or a coronal plane. And it gives us again two additional anatomic terms that describe the relationships relative of structures relative to that coronal plane. Any structure that lies closer to the front of the body is considered to be anterior. In contrast, any structure that lies closer to the back or the back of the body is posterior. For example, the umbilicus or the belly button is a key anatomic landmark on the anterior abdominal wall, whereas basically the vertebral column that we can't see well here is positioned in the midline in the posterior part of the body wall. So again, we have a series of anatomic terms that are describing the position of anatomic structures relative to a coronal plane. For example, the palm of the hand that we illustrated in lecture 1 faces forward, therefore the palm of the hand is anterior to the back of the hand, which is called the dorsal aspect of the hand. So again, we have two additional terms which we will use quite readily to describe the relationship and position, for example, of muscles and joints. For example, this body part right here would be the anterior aspect of the arm, and the part of the body that's on the other side of that would be the posterior aspect of the arm, and we're going to organize muscles that are found in the arm in that exact way, as an example. Then, mutually perpendicular to the sagittal and the coronal plane is a horizontal or a transverse plane. And obviously the transverse plane basically can occur at any level of the body. We can have a transverse plane as illustrated here through the forearm. We could have a transverse plane through the arm, and so on. But again, the presence of the transverse plane creates two additional terms describing structures relative to it. Basically, structures that are toward the head or that lie above the transverse plane that's illustrated here are considered to be superior. This doesn't mean that they are better, they are just superior in terms of the anatomic position. Whereas a structure that is situated below this transverse or horizontal plane will be referred to as something that is inferior. So looking at this anatomically, let's shift our attention to our friend over here on the left, we would say, using this terminology, that the elbow joint is superior to the hand. But we would say that also that the elbow joint is inferior to the shoulder, based on the anatomic position relative to a hypothetical transverse plane. Then we will also be using two other terms that are specifically related to, in this case, the upper limb. Anatomists and health professionals also refer to a series of structures that might be situated closer or further away from a reference point. And the reference point that we use for the upper limb might be at the area, for example, of the shoulder. So using the shoulder as a reference point, we would describe structures that are either closer to the reference point, meaning that they are proximal, compared with structures that are further away from the reference point, which means they are distal. So we will use the terms proximal and distal with some frequency when we talk about structures relative to the shoulder. So using that terminology, we would say that the arm is proximal to the forearm, or the hand is distal to the forearm, using this anatomic terminology. So we're going to get used to using these terms as we go forward in describing the anatomy of the upper limb. All right, then, there are three very important regions of the upper limb. One of them is the anatomic region known as the axilla. Another one is lying just in front of the elbow joint. That's where the so-called cubital fossa is. A fossa is a shallow depression. And one with a great deal of clinical relevance is the so-called carpal tunnel. So let's look at these three regions as we kind of begin to introduce some of the anatomic and fascinating details that make up the upper limb. So you may not have heard the term axilla before, but it seems to be the area in green that's kind of around the pectoral girdle, which we know is formed by the clavicle and the scapula, and kind of includes the area of where the head of the humerus is articulating with the scapula. So the axilla looks like it's partially covering these three proximal joints in the upper limb, and it is. Whereas the cubital fossa seems to be fairly closely related to the anterior aspect of the elbow joint. And the carpal tunnel certainly looks like it is a region of the upper limb that's laid out across the rows of carpal bones that make up the anatomic wrist. So first off, what is the axilla? Well, bottom line is, it's the armpit. And the armpit, as everyone knows, if they raise their arm above their shoulder, forms a shallow depression, basically just underneath the shoulder joint, and closely associated with the proximal portion of the arm. So the walls, as we will see, of the armpit or the axilla are largely muscular. And as we will see, this is kind of a pyramidal shaped area formed by three different sets of muscles forming one of each of the three sides of this pyramid. But the significance of the axilla anatomically is that it's going to be traversed by the neurovascular bundle, the nerves, arteries, and veins that are supplying the upper limb. So we'll have much more to say about the functions of the muscles that make up the armpit, but let's just look at them anatomically in proper register. So as we said, the axilla or the armpit is kind of a three-sided pyramid. One of its walls is formed by the chest wall itself and a muscle that's covering it. Then the other two walls are formed by muscles that cover the anterior, or in part are closely related to the hip joint situated just posterior to this anatomic region. And as we'll see, traversing the length of the axilla, it's actually opened at both ends. It has a narrow proximal opening and a very large distal opening. In the direction of the arrow will be the nerves, arteries, and veins that are supplying the upper limb. So anatomically, it's a very important region. So in our next view, you can see in cross-section the muscles that are making up the three sides of this pyramidal-shaped area. And we're not going to name the muscles at this point. We'll revisit them when we talk about how they specifically act on the shoulder or the pectoral girdle. Just suffice it to say that we have an anterior wall formed by a couple of pectoral muscles, a medial wall formed by the rib cage and a covering muscle called the serratus anterior, and a posterior wall that's largely formed by a muscle called the subscapularis, with some contributions from something called teres major and latissimus dorsi. But what we want to emphasize basically is what's running through the axilla. A fascinating array of an intermingling of nerve fibers that innervate the skin and muscles and joints of the upper limb. And you can see how these nerve fibers that are shown here in yellow kind of are enveloping and encompassing the major arterial blood supply to the upper limb, which we can see is also coursing through the axilla. And what's been cut away here basically is the large vein that's draining much of the upper limb. And note that all three of these neurovascular structures are traversing the interior of the pyramidal-shaped axilla. So again, much more to be said about them. But now let's look at the cubital fossa. The cubital fossa is an anatomic region that is largely lying anterior to the elbow joint. And what is significant about the axilla is that, number one, it is a major place where the singular artery that runs down the length of the arm is going to divide into two. It's going to divide into an ulnar artery and a radial artery. And another word for the word arm is brachium. So there's a single large artery that runs through the distal part of the arm called the brachial artery. And within the confines of the cubital fossa, the brachial artery is dividing into two tubes of about equal size. The radial artery, coursing in close proximity to the radius, and an ulnar artery coursing on the medial side of the forearm. So note the significance of the radial artery. The radial artery is commonly compressed right there against the distal end of the radius to give a health professional an evaluation of the so-called radial pulse. But lying much more superficial or closer to the skin and crossing obliquely across the cubital fossa is something called the median cubital vein. Its claim to fame is it's the vein that phlebotomists look for when they were attempting to draw blood, basically in someone who's undergoing a blood test. So the word phlebotomy literally means to cut a vein. But however, the phlebotomist is not cutting your vein, they're simply inserting a needle into it and draining some venous blood out of it to evaluate, obviously, blood chemistry. So that's another significant anatomic feature of a vascular structure that is lying much closer to the skin and therefore is much accessible, but this median cubital vein stretches kind of obliquely across the anterior aspect of the cubital fossa. Then, what about the carpal tunnel? There's our carpal tunnel. We indicated earlier that it is an anatomic region that is largely formed by a series of carpal bones. And the claim to fame of the carpal tunnel is that it is a region of the anatomic wrist that is actually being crossed by 9 individual tendons. 9 tendons of muscles that have muscle bellies in the anterior aspect of the forearm, but have tendons that cross the anatomic wrist and will act, as we'll see, on the thumb and fingers in various ways. But the most significant structure clinically that's traversing the carpal tunnel is the structure that's shown here in yellow. And that structure is the median nerve. Because everyone out there knows someone, or maybe has had, carpal tunnel syndrome. Carpal tunnel syndrome is a pathologic process frequently related to overuse injuries where fluid builds up and tends to compress the median nerve, and when the median nerve is compressed, patients develop carpal tunnel syndrome. So if we look kind of at a section view of that, you can see this view illustrating the 9 tendons that are traversing the carpal tunnel. We'll be more specific about their names going forward. But again, I want you to realize the significance of the fact that the only neuro or vascular structure that's traversing the tunnel is the median nerve. Blood vessels and other nerves that supply the hand reach the hand by coursing outside of the carpal tunnel. So the bottom line so far, it is that median nerve that is going to be compressed as it traverses the carpal tunnel, and it's going to cause basically numbness, tingling, and pain in the sensory areas that are being innervated by that nerve. So this concludes our second lecture, and it gave us an opportunity to introduce the phenomenon or the features of the anatomic position, gave us some terminology we can hang our hat on with regard to the positions of anatomic structures relative to that anatomic position, and it gave us a way to introduce some anatomically important areas in the upper limb, including the axilla, the cubital fossa, and the carpal tunnel. Using our digital atlas, now let's look at the structures that traverse the boundaries of the axilla. And this particular view shows the clavicle and the scapula and the proximal portion of the humerus. And having removed in the digital atlas the walls, the muscular walls that make up the axilla, you can see what's traversing it. A tremendous series of arteries, nerves, and veins. The arteries are branches of a composite structure that we'll talk about that supplies arterial blood supply to the upper limb. What you see in the axilla at the area indicated and highlighted now is the so-called axillary artery. The axillary vein lies just adjacent to it, but the most fascinating structures in the axilla are a prominent series of nerve fibers that make up the so-called brachial plexus, which will provide, as we will see, the innervation of muscles, skin, and joints that make up the upper limb, and we'll have extensive conversation about that in a subsequent lecture. An additional fascinating area of the upper limb is the area of the carpal tunnel that we've mentioned. Carpal tunnel will be a major anatomic region where a number of tendons of forearm muscles pass through to reach and act at various joints of the thumb and the fingers. And if we kind of remove the structures that are superficial to the carpal tunnel, the major one bounding it forming the so-called flexor retinaculum, if we hide that, we can look into where the carpal tunnel is and see the tendons and particularly the branches of a very important nerve right here called the median nerve that sends its branches through it.